So with studies that have been done to date, the way that people have been investigating early changes in blood sugar levels in children who are at risk of developing type 1 diabetes are based on the standard tests. So for example, they might do a blood test where the child's been asked to fast and they check the blood sugar level when they've been fasted. They may do a test called HbA1c, which again is a blood test, but that looks at your average blood glucose levels over the previous 3 months. And then a more detailed investigation is called an oral glucose tolerance test, which is where the child would be given a set amount of sugar to drink, and then there's a series of blood tests that are done to see how the glucose levels change over the following 2 hours. The difference with using a sensor is that the sensor gives you a real day-to-day living, 24-hour day. You get a reading sent about every 5 minutes, so it's a lot of readings that you get with a sensor. So you can look at whether there's changes on a more detailed level, for example, when the kids are eating, when they're sleeping, and they don't have to be fasted for it, they don't need to change anything that they're doing. They eat what they normally eat, they exercise, do all the things they would normally be doing, but we get a much more detailed picture that can hopefully pick up minor variations which you wouldn't get from a one-off test, just of a particular snapshot that you do the test.
And what is the ultimate hope of seeing this detail over time, that you might be able to delay or prevent? What do you think could ultimately work?
Well, the ultimate hope is to prevent these children from developing clinical type 1 diabetes in the end. Ideally, we'll use this study to try and differentiate and work out which kids look like they are further down the path of developing the disease. So not only do they have the autoimmune process happening, but the autoimmune process has progressed to a level where there's changes, minor changes perhaps, that in their blood glucose levels on a day-to-day basis. What the study findings will then hopefully work towards is either identifying these children earlier so that if there are prevention or interventions in the future or being investigated in other trials, that these children may become eligible for earlier. Also, it may inform how we monitor these children in the future, whether we need to be using sensors more regularly or perhaps as a standard practice in these children. And also it should help alleviate some of the anxiety for the parents and the families in being able to give them a bit more information about what's happening, which may not be visible, in day-to-day symptoms that the child might have, and give them the information and signs to look for to prevent the children becoming sick further on towards the course if they do develop type 1 diabetes.